I bet that hurts. That probably hurts a lot. But why does an injury like that hurt? You probably know that nerves signal your brain creating pain when you get injured. But what tells the nerve that an injury occurred? Another question. Your body temperature runs pretty close to 98.6 degrees Fahrenheit, except when you get sick. Why 98.6? Why not 72? You probably have similar questions about your body. So thanks for taking a look at Medical Investigation 101. I'm the Griffith member of the writing partnership for the book. The other guy, my cousin, Dr. Hill, had a career as a foot surgeon while I was an anesthesiologist. Neither of us had any idea of going into medical practice when we were teenagers, but we probably wondered about many of the same questions about the body that you have asked yourself. Dr. Hill wanted to play baseball as a career. I had decided on physics and engineering, but instead we ended up in medicine. We wrote the book for teenagers who might be starting to decide on their life's career. Adults, parents, teachers, all try to guide young people to get them ready for success in their adult life. We usually base our guidance on our own life story. We know we should use our expectations of the future as a guide, but that's tough to do because it requires predicting the future. But I'm definitely sure that medicine in the future will look very, very different from the way it looks today. At the same time, I hope some key qualities will stay exactly the same. For example, I believe in the coming decades we will find ways to avoid memorizing vast quantities of information to be effective medical practitioners. Instead, we will have methods to correctly diagnose and treat with a high degree of accuracy, not relying on memory. We should continue to insist that medical professionals care more about their patients as people without focusing entirely on their disorder. I think the most important section of our book talks about people who have an earnest desire to help others, but decide they cannot pursue a medical profession because seeing blood makes their stomach queasy, or worse. We tell you in the book that you can just ignore that concern. That concern should not stop you. Everybody has it. But the process of medical training gives you much more important concerns to focus your full attention on in an emergency situation. When you actually have an opportunity to use your skills to save a life, you won't notice your stomach at all. Please do not let your queasy stomach stop you from doing something truly important and vastly rewarding. I happen to think that the empathy, which makes caring people worry about their ability to manage a bloody situation, I think that empathy, in fact, makes those people exactly the individuals we want to have help us when we need help urgently. I hope that makes sense to you, and I pray that our book will actually give talented, sensitive people, perhaps you, permission to think about a medical career that you might otherwise have ruled out. Medical knowledge constantly expands, and learning everything long ago became quite impossible for the human mind. The current challenge in medical science lies in figuring out how dedicated but normal humans can reliably work through patients' problems and get for them the correct treatment every time without any mistakes. There is so much to know and figure out that mistakes seem almost inevitable, and yet mistakes are devastating and intolerable. The rapidly emerging science of artificial intelligence offers great hope, and experts feel it will rapidly change our lives over the next few decades. I think the opportunity to apply that capability to the healing arts will prove very exciting for young people who decide now to pursue a career in medicine. I expect the stethoscope to go right into the trash, and we will examine patients in the future with ultrasonic imaging and other new tools that can find problems long before the patient even has symptoms. And there will be advances in genetics and pharmacology that no one can currently even imagine. If you read our book and you find things you feel need improving, please let us know. We tried to stress insights over details as we wrote it, but we were not always successful. If you think the book has value, we would be happy to try to improve it using your suggestions for the benefit of younger readers who will come along behind you.